Hello, I'm Jon Salmanton-García from the University Hospital of Cologne in Germany, and today I would like to speak to you about the latest EPICOVIDEHA publication. Immunosuppressive agents are associated with inferior outcome of SARS-CoV-2 infection in Philadelphia-negative chronic myeloproliferative neoplasms. These are my disclosures and also the disclosures of the whole project. And as always, just a bit of background regarding EPICOVIDEHA. We are an international registry for COVID-19 patients with hematological malignancies. We collect the data retrospectively since the beginning of the pandemic, and so far we have collected more than 9,000 cases. This means that we are still recruiting patients, and we are always open to get your patients from the beginning of the pandemic until the current moment. And that's what we call the continuous recruitment. It is a collaborative effort, meaning that when we do a publication, if you are an author of the patients included in it, you are granted as author or as a collaborator. And we are working together with more than 150 institutions in more than 40 countries all around the world. Now, specifically about this publication, we can say that Philadelphia-negative chronic myeloproliferative neoplasms typically incurring high rates of thrombosis and infections. Actually, the risk for viral infections is threefold higher in myeloproliferative neoplasms as in other malignancies. In this manuscript, we aim to retrospectively analyze the outcome and risk factors for mortality and also hospitalization in a large series of patients from EPICOVIDEHA. In total, we collected data from 308 patients. 28% of them had essential thrombocytopenia, 45% myelofibrosis, and 27% polycythemia vera. The sex distribution was, in the overall sample, 60% male, 40% female, and this proportion was more or less stable in the three malignancies. Males were 50% in essential thrombocytopenia, 63% in myelofibrosis, and 66% in polycythemia vera. The median age of the patients was 69 years old, and the baseline comorbidities, the most relevant ones, were cardiopathy, which was reported from 1/3 of the patients, diabetes mellitus, and chronic pulmonary disease. These two between or around the 15% of the whole sample. The first aim was to describe the hospitalization predictors in our patients. And as you can see in the screen, in the right section, actually, in the multivariable analysis, we observe how age over 70 years old, reception of immunosuppressive therapies immediately before COVID-19, and the presence of at least one comorbidity were observed as risk factors. In the case of the mortality predictors, again, in the right section of your screen, in the multivariable analysis, in this Cox regression, we could observe how the age over 70 years old, together with myelofibrosis, the presence of two or more comorbidities at COVID-19 onset and the admission in the ICU were observed as associated with the eventual mortality. Thus, we can summarize and conclude that COVID-19 in myeloproliferative neoplasms is more prevalent in the case of the patients with myelofibrosis. The risks associated to hospitalization are age over 70 years old, previous immunosuppressive therapy, and comorbidities. In the case of the mortality, we have age over 70 years old, myelofibrosis, two or more comorbidities, and ICU admission. And with all this, we can say that appropriate preventive strategies are necessary to be targeted at patients with a higher risk. Finally, last but not least, in case you want to participate, in case you want to contribute your cases to EPICOVIDEHA, please feel free to contact me either via email at sending an email to jon.salmanton-garcia at uk-köln.de or contacting me via Twitter. Thank you very much, and see you next time.